So rising healthcare costs and inflation. It's not looking great for inflation right now, but is the worst coming in 2023 for healthcare costs? Maybe, but more likely it'll be 2024 or beyond. Now, I'm not a fortune teller, so how do I know, right? Because I went through 84 years of healthcare and inflation data to find this answer out for you. And boy, were the results interesting. So how and when will inflation impact healthcare costs? And why? You'll have your answers by the end of this video. As of this taping, the latest CPI number, Consumer Price Index number, has year-over-year inflation at 7.5%. CPI is our thermometer for inflation and measures the average price change in a specific basket of consumer goods and services that we pay for. This 7.5% annual inflation rate is the highest it's been in 40 odd years. So bad. But the annual healthcare inflation rate right now, it's only 2.5%, 5 whole percentage points less than inflation. So good, right? According to investment and research platform WWII, this 2.5% healthcare inflation number is lower than the long-term average of 5.2%, less than half of that in fact. So not just good, but great, right? Well, things aren't always as they seem, especially after I show you all the good inflation stuff we discovered between 1938 and 2022. Let's dive into our first great inflation and healthcare nugget. If you're wondering why I started with inflation and healthcare costs in 1938, yes, it's because World War II is a great example to start with, but it's also because 1938 is the first year that healthcare inflation data is available, so there wasn't much choice. My initial intention was actually to start with the Great Depression. Anyway, World War II it is. As you can see, in normal times, in this case, 1938, 1939, and 1940, before we entered the war, annual healthcare inflation was higher than annual overall inflation. And in normal times, this is the case. Between 1938 and 2022, annual healthcare inflation was on average 1.6% higher than annual overall inflation. Normal times means no war, no Fed raising rates rapidly to 20%, no tech or housing bubble burst, and of course, no pandemic. That's normal times. In non-normal times, however, in this example, that's 1941 and 1942, are peak years of military buildup when the government drafted more and more soldiers and contracted more and more people to build more and more military equipment. In these non-normal times, 1941 and 1942, healthcare inflation sank below overall inflation, way below, like our current circumstance. What happened the 3 years after this, though, when times were normal again? Well, annual healthcare inflation went up again to a level that, like before the war, was higher than annual inflation. But annual healthcare inflation didn't just go up a little. It went way, way up. And it stayed way, way up for 3 years, catching up to and substantially overtaking overall inflation. Basically, what you see is that there's a time lag between high overall inflation and high healthcare inflation. Overall inflation goes up first, and healthcare inflation follows 2 or 3 years later. In the case of World War II, this time lag was 2 years. It took 2 years of high overall inflation before this hit healthcare costs in 1943, 1944, and 1945. Which means for us right now, if this current level of high overall inflation stays for just a year, we'll see our healthcare costs rising sharply in 2023. If our current level of high overall inflation stays through 2023, then we'll see those massive healthcare price increases in 2024 and beyond. And if you're thinking, Jennifer, that's one example. Well, that's why I went through 84 years of healthcare and inflation data for you. This cycle repeats itself over and over again. Generally speaking, when the difference between healthcare inflation and overall inflation is less than 1%, or worse, negative, meaning healthcare inflation is less than overall inflation, like it is currently, What follows every time is a big spike in healthcare inflation in the years afterwards. Here's another example. The late 1970s was the last time anyone ever saw inflation rates even close to what we're experiencing now. While the circumstances that led us to high inflation then are different from now, this historical example still has the most parallels to our current one. In 1977 and 1978, before the Federal Reserve started their rate hikes all the way up to 20% to combat inflation, annual healthcare inflation, as typical, was running higher than annual overall inflation. From 1979 through to 1981, during the worst period of the Fed's rate hike to bring inflation down, healthcare inflation fell below overall inflation. Again, in this instance, after 3 consecutive years below overall inflation, healthcare inflation shot up above overall inflation to catch up, so to say, and then some. Now, I don't have a crystal ball, but 84 years of data is a lot of data points. And the same pattern can be found again and again after the dot-com bubble burst of the 2000s and the Great Recession of 2008. So I'll repeat this again because it's important. Generally speaking, what historical inflation data shows us is that when the difference between healthcare inflation and overall inflation is less than 1%, or worse, negative, meaning healthcare inflation is less than overall inflation, like it is currently, what follows every time is a big spike in healthcare inflation in the years afterwards. As of this taping, annual healthcare inflation is 5% less than annual overall inflation. That's a whole lot of catching up that healthcare inflation has to do to retake its place above overall inflation. Remember, since 1938, annual healthcare inflation has been averaging 1.6% higher than annual overall inflation. With overall inflation just beginning its journey at 7+% now, when healthcare inflation does catch up to and zooms past overall inflation in 2023, 2024, or beyond, it will be super painful for all of us, for our everyday healthcare costs, but also for retirement planning purposes, because as we all know, healthcare is a big expense in retirement. Now, if you're thinking, great, I'm going to burn through even more of my savings with rising inflation and healthcare costs, what can I do about it? Well, there's some basics that we can all do right now to inflation-proof our finances as much as we can. Check out a video here for the 4 must-dos in times of high inflation. I've also linked it in our inflation playlist below. And there are also other things that are quite age-specific and healthcare-specific. Be sure to like because I'll be talking about all that and more over the next few weeks and months here. And if you can't wait, then drop me a note at jennifer@diamondnestegg.com to see if we can work together to inflation-proof your finances and healthcare sooner rather than later. So why is there a time lag between overall inflation and healthcare inflation? Very simply, it's because most of the healthcare industry, unlike many other industries, work on long-term contracts with little flexibility. So for example, if the price of flour goes up today, it's pretty easy for your local bakery or supermarket to raise the price of a loaf of bread. Likewise, if the cost of beef goes up, your local restaurant can just raise hamburger prices tomorrow. You can't really do this for healthcare services because all the prices have been pre-negotiated between insurance companies, hospitals, doctors, and other providers, including those that provide public programs like Medicare. I suppose this is because the prices you and I, that we are paying for our healthcare today, these prices were already pre-agreed and preset a year or more ago. And all of this was written into legal binding contracts. Not much wiggle room, as you can imagine. And that's why there's always this time lag between overall inflation and healthcare inflation. Why the rising costs of healthcare consistently lag the rising cost of food, gasoline, and so on. Because the health insurance companies and healthcare providers are still tied to existing contract terms that they can't break out of. So, it's only after these healthcare contracts expire in 2022 and 2023, after the new prices incorporating the higher rate of overall inflation are negotiated and finalized for the next cycle of long-term contracts, that we will see how high our healthcare costs will go, how badly the 7.5% will hit our pockets. Who knows, right? This 7.5% might even go higher over the course of this year and the next. And listen, the healthcare industry is facing the same problems that are driving up prices everywhere else. They also have difficulty filling open positions, especially with all the medical professionals who have left their jobs during COVID. Many hospitals and other medical facilities have been forced to increase pay and benefits to retain existing staff and hire new temporary employees, which further pushes up their costs. Rising staff shortages and increased costs, both personnel and supply chain related, combined with long-term contracts that have pre-COVID, pre-inflationary pricing, meaning the healthcare industry can't just pass the prices on to you and me like our local bakery, supermarket, or restaurant. That's a lot of catch-up waiting to happen for healthcare inflation. So when the time for negotiations comes this year and next, the healthcare industry, think hospitals, doctors, nurses, and pharmacies, they'll argue hard and demand significantly more money from insurance companies for everything from annual checkups and special procedures to the prescriptions you need to fill. And what that means ultimately for you and me is higher premiums, deductibles, and co-insurance. We'll be squeezed from all sides. So while we may feel inflation now in almost every aspect of our life, it's only the beginning. We'll really only be hit with healthcare inflation, the rising cost of healthcare, in 2023 and beyond, when all these new healthcare contracts are negotiated and in place. But as I keep saying to our friends and clients, this too shall pass. Those before us have survived other inflationary periods and the continuous rise in healthcare costs over the decades, and we'll survive this one as well. If we do some very specific things to protect and build our wealth during these times of high inflation. If we can keep and grow as much of our hard-earned dollars as possible. This video here is going to walk you through what these 4 inflationary must-dos are, so be sure to check it out. And don't forget to like, and I'll be giving you a lot more actionable steps for specifically combating healthcare inflation in the near future, no matter how old you are. Thanks for watching, and see you next week with another inflation and your money video. Make sure you don't miss that one.